What's up, everybody? Welcome to today's video blog where we're going to be answering some of the most frequently asked questions about ALS. And let's get right into it. The first question that we get the most often is, what is ALS disease? And ALS disease is a disease basically where the muscles of the body disintegrate slowly and your mind stays completely intact. So you are watching, you are aware of what's happening, and your muscles disintegrate to the point where you can't brush your teeth, you can't get out of bed, you can't walk, and then eventually you can't breathe on your own. ALS has no cure. There is still no known cause. It was discovered in the 1860s by a French doctor. It certainly rose to prominence in the United States in the 30s when Lou Gehrig, the great Yankee, was diagnosed with the disease. He had to retire early and then eventually went on to die, as all who have been diagnosed with ALS have. The second question we get a lot is, if I or a family member has ALS, how do I find a doctor to help with my treatment? And the best way to do this is actually to go through your insurance company. Go talk to them, explain what's going on. There are hundreds of neurologists in the Phoenix area. There are neurologists all across the United States and the world who have experience treating this disease. It's not as uncommon as you might think. So your insurance company not only will be able to match you up with a doctor who has been there and done that and can sort of help you through this process, but they'll also be able to find a doctor who fits into the terms of your coverage plan so that you won't have too much out-of-pocket costs. The third question we're going to cover today is, how can creatine help ALS patients? And creatine can help ALS patients. Many of you may know the dietary supplement creatine. It helps aid in muscle recovery. It's used a lot by bodybuilders. Basically what it does is it draws water to the muscles to help them recover, help them grow. So ALS patients who are experiencing this sort of muscle disintegration will have a really tough time using their muscles. As the disease is in the early stages, they'll really feel weak and just have a tough time getting around doing everyday tasks. And so creatine can help with that. It can help the muscles heal and recover faster. It certainly will not slow the progression of the disease. And the ALS Association warns that since it's not a drug, it's not regulated by the FDA, but many ALS patients have found that creatine can help muscle recovery, can help day-to-day recovery, and help you feel stronger in the early stages of ALS. But certainly check with your doctor before you begin any sort of supplement or medication when in any situation, but especially when diagnosed with ALS. So that's going to be it for today. You can go to the blog roddyASU.wordpress.com, and we'll have some more questions answered for you there a little bit later today, but that'll be it for us. Thanks.